we know that, yes, if you're somebody who is poor or who's lower on a socioeconomic ladder, then yeah, that's obviously going to have an impact on mental health. You're going to be facing greater stressors, right? If you can't get food for your family, if you have to deal with medical bills that you can't possibly afford, or you're not sure if you'll have housing tomorrow, right? That's kind of an obvious way that economic inequality can impact people who are poor and working class. What's sometimes not seen at face value, but that also comes through in the data, is that people who are middle class are always sort of in the precarious middle class. Whether in reality they're precarious or not, but in their minds they can have this anxiety that if I suddenly get a medical bill, even though I have insurance, even though I make a good income, could that suddenly send me tumbling down? Or if I have, you know, a house and a car, but my neighbor has a house and then another house and then 2 cars, well, suddenly, well, why don't I have the things that they have? Am I failing somehow because I'm not reaching their level? There's a book that came out recently by, I think his name is Michael Mechanic, called Jackpot, where he brings together both social and personality psychological research and interviews with people who are wealthy, and just noting all the different ways that extremely wealthy people can become very neurotic and struggle. And this isn't to like, oh, the poor rich people, but to underscore that when you have absolutely insane levels of inequality, there is no win condition. You're always trying to go to some higher place, or you're trying to make sure you don't fall into a lower place, and then suddenly you start being hypervigilant and suspicious of everyone because you can't possibly trust everyone. What, are they coming at me for my money? So you see, it's like a very different set of stressors, but it's still a set of stressors that can drive people into therapy, frankly, but it's all connected to the same problem, which is the absurd levels of inequality that we live in. And again, that isn't to in any way whitewash or erase the suffering of people who are poor, or to erase the suffering of people who are marginalized. But it is a way of underscoring that because we're all in this system, we're all connected. So the reason that that very wealthy person who is nonetheless like very isolated in their family, drinking, probably struggling with suicidal thoughts, the reason why they suffer is because we live in a society that makes so many others, the broad swath of the population, suffer. In the context of therapy, it might mean underscoring that the reason why that white male cis heterosexual person suffers isn't just because of dynamics with their parents, but also because no matter how well they do, there is no such thing as doing well enough. And that desire to keep climbing winds up having a corrosive effect on their relationships, on feeling comfortable in their lives, of feeling that they are a human being who has value outside of money or outside of a racial position, for example. So to make a long story short, it might mean actually verbalizing some of those things and talking through to what extent does living this way serve you? What other way would I have to live if not continuing to try to make more money and succeed more? Can I live in another way that would actually help me feel connected to people, embedded in my community, and then more broadly care for fellow human beings instead of looking down on them like they are a danger to you?
Right, and so I mean, it almost sounds like there's going to be like these hidden, unspoken parts of pain, terror for this person,
yeah,
that if you as a therapist don't address, those will persist.
Yeah. I mean, let me give you the kind of the converse example.
Yeah.
So I've read multiple case studies that sound exactly like this, which is the therapist, the writer, will talk about a patient. Maybe it's a white male who's middle class, owns a business, doing well, but comes to therapy with this feeling that no matter what they do, they're never good enough, and they're not where they're supposed to be. But no matter how hard they work, they can never get there. And that, to me, has all these resonances with hierarchy, right? I am here, I'm supposed to be here, but I'm not able to get there somehow, right? So my ears would start to get tipped off as to, I wonder if there are issues around, say, masculinity and toxic masculinity, where this person feels like, oh, I'm not man enough because I'm not doing X, Y, or Z, or I'm not accomplished enough because I don't have a yacht or whatever. So the things that might tip off my ears for many writers that I've seen of this kind will then completely ignore that language and focus on some mom-dad dynamics. And maybe they'll say, oh, well, the mom was very demanding, and the mom put all these pressures that they had to keep working really hard. And so suddenly, they kind of start talking about those themes, but it stops at their mom. And even if they don't want to blame the mom, the work that the paper or the book or the whatever might do is to say that all this goes back to the mom, rather than asking, well, what pressures might the mom also been under that would drive her to relate to her child in this way? Is it possible that perhaps mom wasn't able to complete her education, but still had these desires and yearnings that maybe her child would, and so she felt like she had to put these pressures on her child, or else she wouldn't be able to achieve something that society had neglected her, right? And there could be many other examples, but in some, that there's a broader world besides the mom and the dad that could be exerting this pressure that then manifests as, I feel like I should be in a better job or a higher place, but I'm not. That might go back to broader social and economic forces. And so that talking about that clinically would not only like help a client kind of think about these broader cultural forces, but also have perhaps some empathy in this case for the mom. Like, it's not just your mom was bad and put these pressures on you. Mom is also responding to something else, whether it's in the family or the broader social world. And so then also see mom and dad as human beings trying to survive in this broader society.